Hi, I'm Dr. Mangesh Kamath. I'm a senior consultant medical oncologist, hemato oncologist, and bone marrow transplant physician. I practice at Helios Cancer and Hematology Clinics in Bangalore. Having treated thousands of patients in my practice, there are seldom consultations that are completed without discussing the cost of cancer treatment. Unfortunately, a majority of our patients have not availed health insurance before they developed cancer or any other diseases. So most of the patients that we see are paying out of their pockets, out of their savings. So how can the cost of treatment of cancer be reduced? One is definitely to avail health insurance at an earlier age so that you do not have to suffer by exhausting your savings. The second and probably understated fact is that do take a health insurance with an adequate cover. Taking a health insurance with coverage of 1 or 2 lakhs is seldom enough to even treat food poisoning related admission. Next is when the patient is newly diagnosed. When the patient is newly diagnosed, if the patient is evaluated simultaneously by a multidisciplinary team of medical oncologist, surgical oncologist, radiation oncologist, allied specialties which are very important such as pathologist, radiologist, rehabilitation medicine specialist, if all of the team members can get together at the same time, the best protocol can be devised such that patient can receive the best of treatment and also the most cost effective treatment. It doesn't happen all the time in India. Patient goes uh, gets operated, then comes to a medical oncologist, and then goes to a radiation oncologist. So the opinions are given after that phase of treatment is over. While I am glad that the best treatment is given, there are scenarios where if all of them have been uh, well decided at the same time, that certain costs can be reduced. Next is to make sure that you follow all the advice of the oncologist, whether it could be the surgical oncologist, medical oncologist, or radiation oncologist, because as the old saying goes, a stitch in time saves nine. So if you do get certain symptoms such as maybe vomiting, immediately contact your medical oncologist, and certain medications can be given so that you don't suffer from vomiting. If you get fever, make sure you contact your medical oncologist so that the fever can be uh, tackled in the nicest and the fastest possible way. Next is make sure you have the healthiest of diets, because when you have the healthiest of diets, it also gives you an added advantage in the treatment and management of the cancer. The diet advice can go a long way in making sure that you are having a good experience while undergoing therapy. Make sure you follow all the prescriptions properly so that you don't get any side effects or you don't get any effects which are not managed on time. Make sure to discuss everything. So please make sure you discuss with your oncologist what is your budget, what is the best you can spend. Make sure you ask your oncologist what is required from your side, from the financial aspect as well. Make sure you ask the oncologist for other options, whether the same treatment or a slightly different treatment can be offered to you at slightly lower cost. These are very important discussions. They are always brushed under the carpet because you believe we'll tackle it when it comes. But no, if it's discussed at the right time, that's the best time to discuss so that you can avail the best treatment with the less cost. Thank you.